Hello, I'm Dr. Paul Smolin, also known as DocSmo. I'm the founder of DocSmo.com and a practicing pediatrician for the past 31 years to date. I created DocSmo.com to be an educational resource for parents. Portable, practical pediatrics for busy, digitally savvy parents. From the crib to the country club, as we like to say. Thank you for joining me today. Now today I'm going to show you some splinting skills you can use the moment your child sustains an injury. Splinting is an important aspect of injury care because it helps limit the swelling, it gives some pain relief, and it often prevents further injury by stabilizing the injured site. I think it's often better than a cast because it's removable and your child can keep their range of motion and strength while their injury heals. Along with ice, a little bit of compression, and some elevation, splinting is often all that is needed for many sprains. So let's examine some easy splints for some common kid injuries, shall we? Okay, so let's examine a common scenario. This happens all the time. I see this injury all the time. Your little Johnny's out in the neighborhood. He's playing basketball and he gets hit on the end of the finger with a ball that's thrown really hard. The ball hits the finger and it causes some rotation and usually injury to the proximal or the middle phalanx, often in this joint right here. And so what should you do? What should a parent do? Well, you need to examine this hand and this finger. You need to make sure that the finger's not really rotated. That means fractured and rotated or curved. You want to make sure that the finger is pink and warm, not cold and blue or white. If none of those things are there, then it's time to get out some ice. You can run to the fridge, get some ice, put it in a bag and put it on there. Or you can get this instant ice stuff that they sell it in every grocery store or drugstore. You just hit it hard, it turns cold, and we're going to do intermittent ice. On for a few minutes, off for a few minutes, on for a few minutes. Okay, so first is ice, and then we're going to splint this injury. We're essentially going to put a cast. So to splint a finger, you do what's called buddy taping. You put a little gauze between the fingers. That keeps the skin from getting sweaty and macerated. And you just tape one finger to its buddy. If this is a second or third finger injury, you tape those together. If it's a fourth or fifth finger injury, you tape those together. Okay? You can do one piece of tape or you can do two pieces of tape. And it's as simple as that. So the injury occurs, you examine, you make sure the injury is not serious with twisting or deformity or dislocation. Then if not, you ice, we splint, we take Johnny inside and we elevate his hand and we keep doing the icing because that reduces the swelling. So we get this up over his shoulders on a stack of pillows. And he's probably going to be pretty comfortable. And we wait a few days. If he's not getting better after 3 days, it's time to take him to the doctor and get a more thorough evaluation. So you can see with a few basic materials, splinting your child's next injury should be easy. If you think your child could have a serious injury, however, or after splinting for a few days, they're not getting better, make sure you check with that wonderful person you call your child's pediatrician. Until next time.